Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started. You see, I have here the zoom. It's a small little picture, but I made it zoom and see for the chapter. I didn't put this in the outline, which I liked it, but I'm gonna use this also in the next chapters. But the zoom is very poor because it's very small format of the picture. But you see, just a refresher, because it's a chapter 18 is the assessment, and it's all about all those cells, the anatomy and physiology of them. So, but we are in NCLEX, and the NCLEX is broken in the 15 specific domains area. I'm gonna talk about this probably every time, so you can skip it. It's not just about the content, it's just to know how to apply in different situations. So those domains or subcategories, they are the 8 categories, like the traditional one, which is this pie right here, like management of care, psychosocial adaptation, plus the 6 steps of critical judgment. So this is only until March 2026, because after that we have a new style of NCLEX. So prepare, either you do it now, your NCLEX, or you just wait for the next challenge. I am the next challenge. So I'm doing this. I'm gonna master to do this, but guess what? When it's my turn to do the NCLEX, it's in the new NCLEX. So, but it's okay. We'll do it together. We'll manage. So by organizing your notes around those 15 domains, you can learn how you place them into the correct context. So I like to make a question. So how I make my questions, when I did my LVN, I printed this is for the RN. I printed the LVN one at that time, and for each page they will show, like for the safety, it's full of page of hypothetical how they kind of ask you, but it doesn't say, oh, look on the chapter, I'm gonna ask you about immunity. Not, but they will say about infection with skin. So then you have to think about what everything about skin, and then you have to write infection and skin, what I know about it, and mention 5, whatever, how many it pops in your mind. So the more you do it, the better. And I used to write right here, and then sometimes I will take an extra paper and I will write it there, but I don't look in books. So but when I prepare for the LVN NCLEX, that 6 weeks, I will reread my Med-Surg, like page by page, and I remember each page my pain. And then I will go, after that I did the ATI. I had the ATI quizzes, and I had not just the proctors, but I had like a virtual not professor, instructor that will verify how many I do and will do me like a kind of homework to do each day, which was painful. So I kind of spent like a full-time job when I prepared for the last minutes of NCLEX. So this I will always look for every time, every time, every time. And even now the books, when they give you, even for the quizzes, or even in the book, they will tell you what type of question it is. And at the end of each book, they have there a lot of practice questions. And I have the advantage for the Davies, which you have a code and you go online and you do for each chapter practice quizzes. And Davies is like not, it's not kind versus Kaplan, because also I use Kaplan, and then the Kaplan is exactly mimics the NCLEX. So Kaplan is mimics. So why I say that? Because nowadays in 25 the NCLEX is give you a point even if you mistake. Um, each option you do, it's like give you a point. Either you get the full point or little point or zero, because it's not related to the case. So I think each question, the full points, even if you answer one question, might have like safety, psychosocial included in it. So make sure you understand. So take this booklet, just gaze a little bit, play with it. I definitely use it, and next year when 26 March will appear, this new, guess what I will do? The minute it appears, download, print it, and start on it to see. And let's move a little bit forward. I think I talked too much. Please tell me. So you see here it's the NCLEX, the 15 from that candidate performance report. Here you have management of care. Always I mentioned that many students, many candidates will have a problem with this and somewhere in here because they're not custom. So basic care and comfort, make sure that always is fever. I think nobody will say, is not a nurse say like somebody is feverish, say like, oh, you're just fine. No, you're concerned, so you manage that. So you treat the fever. You see, with cold compresses only. So you think like also Tylenol or ibuprofen, but first you do with cold compresses because it's very immediate and it's non-pharmacological, and you don't know this patient. Like I'm telling you, if a patient has aspirin, is taking aspirin, like the baby aspirin, or any other anticoagulants, imagine if you give them ibuprofen. So sometimes they say, it says that it's not good to give, and or even if they don't take, then elderly will have a problem with stomach because of ibuprofen. For me, ibuprofen is my pain relief, better than Tylenol. So Tylenol is not good for my body. And but I mentioned long time ago in other videos that the Medicare likes non-pharmacological first. So a person who is the skin is very warm, very hot, you try to kind of cool them first, and medication comes. Anyway, medication takes longer. So here it's like the priority. And some doctors is like, if has 99, we don't. If it's 100, 100, a little bit 100, then yes. But even if has 99, you need to make sure why it's hot. Either it's infection, or is it just the room it's hot, or just took a shower and it's hot. But make sure with COPD patients, because the oxygen, those machines, they make the room very hot, and it's recommended for the COPD patients in oxygen to have the room a little bit cooler, So I think I talk too much, and you just read on your own. I don't want just to read from here. Well, I did it, so I can read it. You see, like take action, initiate isolation. This is because we're in immunity, so it's like about infection here. Using the epi for the allergic reaction. Remember what is the cell that has for the allergic reaction? Which one? Send me a comment. Just look and CDC, the vaccine protocols. Now I hear in the news they have a different. Okay. This is a little bit shorter because it's just the assessment. It's not much regarding NCLEX. This is like mostly like maybe pop quiz for class. We have 64-year-old retired teacher, wow, early retired, is admitted to the hospital with persistent fatigue, low fever, think about low fever, and so long lymph nodes. She reports recurrent sinus infection over the past year. She also states that small cuts take a long time to heal. Physical exam reveals enlarged cervical lymph nodes, pale conjunctivae, and mild splenomegaly. CBC reveals leukopenia and decreased leukocytes count. The provider orders further immune function testing and starts supportive treatment while waiting results. So this is about cells and assessment, anatomy and physiology. Remember, and I said like always will be assessment of a nurse, and diagnostic always and forever, and age related. Which finding supports the suspicion of immune dysfunction of Miss Nelson? So select route apply. Recurrent infection, enlarged lymph nodes, normal white blood cells count per conjunctiva, decreased lymphocytes count. Recurrent infection, because it starts again, and large lymph nodes, it's typical for the infection and typical for this type of chapter, and decreased lymphocytes count. So we know that are common signs of immune dysfunction. Decreased leukocytes count also confirms a problem in adaptive immunity. A normal white blood cells count will not support this suspicion, and pale conjunctivae may indicate anemia, not immune dysfunction. Because normal white blood cells, the white blood cells shows you infection. So if it's normal, why I should suspect it's something wrong if it's within range, normal ranges, right? Here we have the diagnostic test, right? Diagnostic test. The diagnosis text. We do this. The most appropriate to evaluate immune system. Urinalysis, seroprotein electrophoresis, chest X-ray, AKG. But think, we suspect infection. So most appropriate should be this. Because helps to detect hemoglobin levels and can identify immune deficiency or disorders. Which immune system cell is most likely impaired in this patient? Remember, we did a pop quiz at the end of the chapter on outline. Basophils, the killer cells, natural killer cells, the B's, lymphocytes, neutrophils, most. So because they are responsible for humoral immunity, the antibody production, a decrease in lymphocyte count and recurrent infection point to impaired adaptive immune function, likely involving big cells. 4. The nurse prepares to educate our patient on the role of lymphocytes. Which statement is most accurate? So now we have lymphocytes are part of the innate immune system and acts as first responder. The lymphocytes are kill bacteria using phagocytosis. Lymphocytes recognize specific antigen and mount a target response. Lymphocytes cause inflammation by releasing histamine. So we know that it's recognizing specific antigen and mount a target response. Because the lymphocytes is the B and the T cell are part of adaptive immune system. They recognize specific antigen and initiate a specific immune response. Which nursing action has the highest priority? for our patient during the initial phase of care. Educate about nutrition and infection prevention, administer prescribed antibiotics, monitor white blood cell and lymphocytes count, encourage physical activity to improve immunity. So monitor for white blood cell and lymphocytes count, because monitoring white blood cells and lymphocytes count helps to determine the severity or immune suppression and guides further care decision. And we are almost at the end, so promise I don't keep you too long. Which nursing diagnosis in the most appropriate based on our patient presentation. So this is the nursing, they do the diagnostics. So the nursing, they have the risk for deficient fluid volume, risk for impaired skin integrity, ineffective protection related to immune infection, chronic confusion related to infection. So I think you know, we talked about this all in the quiz. So ineffective protection related to immune dysfunction. It's correct because our patient with decreased immune function as it reflects impaired ability to detect against pathogens. So I think this is the last question. I hope I will see you in the next one. And now I'm saying to you my last thoughts and goodbyes.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.